Welcome to The Explainer. Today we're diving into a massive, frankly, game-changing paradigm shift in how we manage diabetes for adults over 65. You know, for decades, the medical approach has felt kind of stuck. It was all about strict numbers and rigid rules. But as we're going to see through the latest clinical data, there's a true revolution in safety and technology happening right now, and it's fundamentally changing how we protect our older loved ones. We're talking about continuous glucose monitoring, or CGM, and why it's rapidly shedding its status as just some optional upgrade. It is absolutely becoming the non-negotiable safety standard for senior care. Let's get right into it.
Okay, let's dive into this. When you think about diabetes, what's the absolute biggest danger that comes to mind? Well, for a long time, the medical community, patients, families, basically everyone, hyper-focused on one main culprit: high blood sugar. We've all been trained to fear the highs, right? Mostly because of the long-term damage they cause. But I actually want you to completely rethink the primary threats when it comes to senior diabetes care. Because as patients age, their biology changes, their risks change, and the data clearly tells us that the most acute, immediate danger to an older adult is actually not high blood sugar.
The clinical consensus right now is super clear. Continuous glucose monitoring is the new gold standard and a vital lifeline for safety. And why use a word as intense as lifeline? Because the real enemy for patients over 65 is sudden, life-threatening lows. Clinically, we call this hypoglycemia. These severe drops in blood sugar can happen completely out of nowhere with zero warning. And as we age, our bodies just become way less equipped to detect and handle them. That makes a device that continuously and objectively monitors those levels absolutely crucial for an older adult's survival and independence.
Section 1. The hidden hypoglycemia danger.
Now, what's really interesting about this is why these lows are so uniquely dangerous for older adults compared to younger patients. A lot of it comes down to how the physical symptoms actually show up. When a younger person gets low blood sugar, the warning signs are usually pretty obvious. They might get really shaky, super hungry, or maybe start sweating profusely. But in older adults, those biological alarm bells just sort of stop ringing. Instead, acute confusion sets in. And this is frequently and tragically brushed off by caregivers as general age-related decline or even dementia. Imagine a senior suddenly getting disoriented or forgetful. A well-meaning caregiver might just assume, oh, they're having a senior moment. But in reality, their brain is literally being starved of glucose. Unmonitored low blood sugar expertly mimics the symptoms of aging, and this is exactly where CGM technology steps in as a total game changer. It gives families objective, real-time data so they can instantly clarify the symptoms and realize it's hypoglycemia, not cognitive decline.
Section 2. Breaking the fall cascade. And this brilliantly illustrates the true life-saving value of a CGM. We really have to understand the visceral, physical mechanics of what actually happens to an older body when severe hypoglycemia strikes. It's not just about feeling a little dizzy. It triggers a really dangerous, often irreversible chain reaction called the fall cascade. Step 1, the blood sugar drops low without any warning. Step 2, because they don't feel the traditional symptoms, acute confusion and disorientation set in completely unnoticed. Step 3, this disorientation leads directly to severe falls and bone fractures. And Step 4, that catastrophic physical trauma leads to a rapid health decline that, sadly, many seniors just never recover from. By providing real-time alerts before the sugar drops too dangerously low, a CGM steps in right at Step 1. It literally stops this whole cascade in its tracks, preventing the confusion, the falls, and the fractures before they even have a chance to start.
I know, that's a pretty heavy reality. But let's pivot to some incredibly bright optimism here, because the clinical results are just staggering. Take a look at this number: 50%. Recent data from the ADA 2026 scientific sessions showed that using a CGM reduces hypoglycemic episodes by more than 50% in adults over 65, compared to those old-school standard finger sticks. Literally half. Just by swapping out those periodic, painful finger pricks for continuous monitoring, we are drastically slashing the risk of those life-threatening lows. And we've got a real 1-2 punch of empirical evidence here, because that actually gets even better: 27%. The sources show that when older adults with type 2 diabetes who require home care support use this technology, they saw a massive 27% increase in their time in range over just a 12-week period. Time in range is exactly what it sounds like. It's the amount of time their blood sugar stays right in that safe, healthy sweet spot. Gaining that level of stability in just 3 months, that is an absolutely massive victory for senior health.
Section 3. The automated tech advantage.
So this continuous stream of data from a CGM isn't just about sounding an alarm when things go wrong. It's actually the foundational technology powering a much wider revolution in how we deliver insulin to patients in the first place. According to the ADT-1D study from our sources, modern, fully automated insulin delivery, which relies entirely on that real-time CGM data, significantly reduces hypoglycemia in seniors compared to the older hybrid closed-loop systems. The automated tech takes that constant data stream and uses it to make instant, precise adjustments to insulin delivery. It's essentially acting like an artificial pancreas. And that takes the guesswork and those dangerous delayed reaction times completely out of the equation for seniors and their families.
Section 4. Rethinking Senior Safety Targets. But look, as amazing as these monitors and automated pumps are, technology alone isn't a silver bullet. To truly empower older adults, this incredible tech requires new clinical approaches, human support, and a fundamental shift in what our actual medical goals even are. We have to treat the whole patient, not just stare at a screen. The data actually confirms that when you pair CGM technology with pharmacist-led group education, the benefits are hugely amplified. It meaningfully improves how high-risk older patients understand and manage their own glucose levels. It's really not enough to just slap a sensor on someone's arm, right? Combining the tech with professional, community-based education ensures that seniors actually understand what their data means. It gives them the confidence to manage their health proactively.
So the crucial point is that this brings us to a monumental philosophical shift in senior care. The ADA 2026 Standards of Care now allows for safer management at relaxed HbA1c targets of 8% or higher. For years, patients and caregivers have been aggressively chasing these perfect numbers, totally terrified of blood sugar running even a little bit high. But this new ADA standard validates what caregivers have intuitively known all along. Chasing those perfect numbers aggressively puts older adults at a massive risk for those sudden deadly drops. By relaxing the targets to 8% or higher, the medical community is prioritizing overall patient safety. We're no longer pursuing aggressive blood sugar lowering if it comes at the expense of putting a senior's life in immediate danger.
Which brings us to our final provocative thought for today's explainer. How will you rethink care priorities for yourself or a loved one? We've seen how continuous glucose monitoring acts as a literal lifeline. It cuts right through the confusion of aging, it breaks the deadly fall cascade, and it's driving this vital shift away from aggressive numbers and toward actual holistic patient safety. If you're helping an older adult navigate diabetes, consider how adopting this lifeline approach could fundamentally change your own family's diabetes management. Thank you so much for joining me for this explainer. Keep questioning, keep learning, and I'll catch you next time.